What are common misconceptions about schizophrenia and intellectual disability? When discussing schizophrenia and intellectual disability, many misunderstandings arise. One common myth is that schizophrenia involves having multiple or split personalities. This is not true. Schizophrenia is different from dissociative identity disorder, which is characterized by fragmented personalities. Instead, schizophrenia primarily includes symptoms like hallucinations, delusions, and disorganized thinking. These symptoms do not involve personality splits, and confusing these conditions can lead to stigma and misinformation. Another misconception is that individuals with schizophrenia are intellectually disabled or lack intelligence. While some people with schizophrenia may experience cognitive impairments, such as difficulties with attention, memory, and learning, this does not mean they have an intellectual disability. In fact, many individuals with schizophrenia have average or above average intelligence. Cognitive symptoms can vary widely among patients, and they exist on a spectrum. This means that cognitive impairment does not define a person's overall intellectual capacity. There is also a belief that people with schizophrenia are dangerous or violent. While some studies show a slightly increased risk of violent behavior, this is often linked to factors like substance abuse rather than schizophrenia itself. Most individuals with schizophrenia are not violent. In fact, they are more likely to be victims of violence due to stigma and misunderstanding. It is essential to clarify that schizophrenia and intellectual disability are separate conditions. Intellectual disability involves limitations in intellectual functioning and adaptive behavior that begin in childhood. On the other hand, schizophrenia is a psychotic disorder that typically emerges in adolescence or early adulthood. Although these conditions can co-occur, having schizophrenia does not mean a person has an intellectual disability. Similarly, having an intellectual disability does not guarantee that someone will develop schizophrenia. Understanding these distinctions is vital. It helps avoid mixing up symptoms and conditions, which can lead to inappropriate treatment and social stigma. Recognizing that schizophrenia involves complex cognitive and perceptual symptoms, not split personalities or a lack of intelligence, can promote accurate diagnosis and compassionate care. This understanding ultimately leads to better outcomes for individuals affected by schizophrenia, regardless of whether they have coexisting intellectual disabilities.